Welcome to dBrief. I, Deepika, will take you through the highlights of the webinar Electronic Health Records and Challenges in PCPNDT Act Compliances in COVID Era, recently organized by DigiShield in association with IMA MS PCPNDT Committee on the 9th August 2020. To dig deep into the understanding of electronic health records and the PCPNDT Act, one must understand its basics. So, what is an electronic health record? Electronic health record is an electronic version of patient's medical history maintained by the provider over time. It may include all the key administrative, clinical data relevant to the person's care under a particular provider. And what does the PCPNDT Act state? PCPNDT was enacted on 20th September 1994 to prohibit prenatal diagnostic techniques for determining the sex of the fetus, leading to female feticide. This opens up a new direction of million confusions. Why is it important to maintain an electronic health record? What challenges can doctor face in the COVID era under the PCPNDT Act? While the medical fraternity is supposed to deal with patients under the restricted and risky circumstances of COVID, the unanswered queries and certain interesting tips were shared in the webinar arranged by DigiShield in collaboration with IMA MS PCPNDT Committee. Dr. Gururaj Lachin initiated the session, a consultant radiologist in Jahangir Hospital, Pune, whose chosen topic was Challenges in Ultrasound Imaging During COVID Times. By reminding the precautionary measures of COVID-19, Dr. Gururaj Lachin began his focus on the topic. As per the Welch Risk Assessment tool of COVID-19, he began to draw each score's conclusion and its required measures. The general principles were laid down by him, which needed to be followed to handle the COVID cases. While returning home, one should keep the family safe through certain measures disclosed by him. To know what those are, let's dive into the video.
You have all these kinds of different solutions for cleaning. Most important, commonly used are quaternary ammonium compounds. But of course, as I said, every manufacturer has different specification, different solution, and follow this rigor. Precautions during disinfection: always use gloves, mask, eye protection while handling disinfectants. So you be safe with these disinfectants. Do not spray them in the equipment room. Only use it directly on the machine. Do not spray alcohol-based disinfectant due to fire hazards.
Up next, Dr. Kalpana Balivan is holding a position as appropriate authority in Pune Municipal Corporation, who began to speak on the chosen topic, registration and renewal. She began to draw attention right from the implementation of PCPNDT Act to having 4 medical officers which are currently working for COVID. The rules regarding the registration and renewal of sonography centers were explained in brief. Let's just know how to register and renew the certificate from Dr. Kalpana Ballivant.
These are the rules, and why I have made a slide of these rules is because my next slide is related to these rules. Rule 578, the more important regarding registration and renewation of the sonography centers. Now this is the Dr. Kangule will find it familiar. This is a additional deputy director had given us a circular and guideline regarding implementation of PCPNDT Act in COVID. So we were given discount, I would say discount or concession. So suspension of Rule 8, 9, Rule 8, 18A. These rules are pertaining to renewation and new registration of the Act. But as you can see, it was only till 30th of June. Can read it. It's temporary till suspension of these rules is temporary till June 2020 due to COVID-19 pandemic, where in whole country is in a lockdown situation. Now, after this whole country lockdown situation, the government, central government and state government, and then local self-government as Pune Municipal Corporation, we had a different, I would say, areas declared for lockdown. Still today also on 2nd September, you must have read in newspapers or maybe on our website, Pune Municipal Corporation, we have declared micro containment zones, a list of micro containment zones. So now totally lockdown has not lifted yet. So central government released the rule of lockdown to they made it for the state government to take their own decisions.
Mr. Dipen Mehta, COO, DigiShield, took the chair where he discussed in detail how DigiShield is enabling doctors to safely and securely practice these testing times of COVID 19. DigiShield can conduct a quick and effective COVID 19 carrier risk screening of every patient before visiting clinics. The webinar turned extremely exciting when Dr. Dinesh Thakre, who is pathologist by profession, started his lucid talk on the topic provision in PCPNDT Act 1994 and suggested amendments. For the better understanding of the PCPNDT Act, he began to explain the same by defining the Act and providing the implications. He shared some of the amendments of the Act in detail and explained the doctor's view. Let's hear one of the amendments from Dr. Dinesh Thakre.
Today's topic is provisions in PCPNDT Act and suggested amendments. While pursuing LLB, I had submitted a legal research paper as a part of practical examination, and the topic was critical analysis of provisions in PCPNDT Act 1994 resulting in harassment of guiltless doctors and suggested amendments. The guide was Dr. Varsha Deshmukh. The abstract, the Prenatal Diagnostic Techniques Act 1994 was enacted to curb female feticides but could not produce expected results. Female feticide is done out of a mindset grown in the response to customs of society. Rather than providing measures to change social mindset, this act penalizes doctors who can detect sex of fetus and adversely restricted use of ESG in diagnosing and monitoring other diseases. While targeting doctors, some provisions in Act cause harassments of guiltless doctors and defend them. Hence, amendments are needed in the Act, which will serve the purpose of Act on one side, as well as stop harassment of the guiltless doctors.
The webinar turned from informative to interactive when the experts properly addressed the doubts and queries. Let's quickly go through a few of them to have a better understanding.
You have done excellent work since you have come in 2018. Before that, there was no gazette notification of state appropriate authority.
We had, sir, just now in April 2019, we had a gazette notification. I have given that copy to you also.
Yes, exactly, sir. Sir, before that, it was not there. So what I want to ask you is, before that, if I have complained to state appropriate authority regarding something, and I have not received the decision yet, and now that the authority is established in 2019 because of gazette notification.
No, listen to me, sir. I have spoken to you also already. Gazette note, whether to issue gazette notification or
Yes,
a general notification is the authority of state government, not
Yes,
mine. We are sending proposal to issue gazette notification only. I have given that letter to you. Whatever previous assistant director also written to government of Maharashtra for gazette notification only. But government of Maharashtra issued just notification, not gazette notification.
What all forms we are supposed to fill for an ART procedure? Like we are filling form F for an ultrasound and antenatal ultrasound. Which other forms D, E, G, what all are we supposed to fill for procedures of oocyte retrieval, embryo transfer and IUI procedures?
But even madam will highlight on this.
There is a classification of your procedures as per invasive and non-invasive.
Yes, ma'am.
So whichever form is applicable for invasive, I think C form. So that particular form you have to fill form C. That is, so the classification of number of the alphabet of form is according to your mode of procedure, whether it is invasive or non-invasive. So list of invasive and non-invasive is also given in the Act. Accordingly, whichever you are claiming you are going to do, accordingly you have to fill the forms.
Form of consent, form G, madam, for invasive tech, form G. or invasive techniques.
And for
That's all.
counseling, ma'am, for counseling also we are supposed to fill any form?
I don't think there is a
I don't think there's any form for counseling.
No, not separate form. No separate
No
form.
separate form. No. Even Dr. Kangule is saying no.
Sir, in
Okay.
centers, sir, in centers where the ultrasound machines are not available and they are not ART centers also, but they are doing procedures like IUI from a sample prepared somewhere in another laboratory. So are those centers also supposed to register under PCPNDT Act?
Yes,
Because they are
ma'am.
dealing with the gametes.
Yes, ma'am. Need to register.
To watch the entire video, please visit our website www.digishield.me and click on the debrief menu.